Good morning, students. Today we are going to start our new chapter, that is chapter number 6, drugs acting on the autonomic nervous system. So, students, um, the central nervous system, or you can say nervous system, it is divided into two parts. First part is central nervous system, and second is peripheral nervous system. So, in central nervous system, what is included? Brain and spinal cord are included in the central nervous system, and all nervous tissue outside the central nervous system, they are covered in the peripheral nervous system. And further, the peripheral nervous system, it is of further two types. First one is autonomic nervous system, and second one is somatic nervous system. The basic function of the autonomic nervous system is to control the involuntary actions. Involuntary actions are the automatic functions which are beyond the control of the human being, like contraction of muscles, heartbeat, etc. So next is somatic nervous system. It controls the motor function system which are under the control of the human being, like movement of limbs, speech, etc. So, and the further autonomic nervous system, it is further divided into two types: sympathetic nervous system and parasympathetic nervous system. The sympathetic nervous system is responsible for the fight or flight response, and the parasympathetic nervous system is feed or breed. It is responsible for the feed or breed. Okay. So students, you have heard about the neurotransmitters. So let us discuss or look at the what are the neurotransmitters are. So these are the substances which are released from the nerve terminals into the synaptic cleft, which then activate or inhibit postsynaptic neuron by binding to the specialized receptors. So the next is neurochemical transmission. So it is a transmission of nerve impulse across synapse located between the neurons or at neuroeffector junction. Next is fundamental steps in the neurochemical transmission. First of all, synthesis of transmitters are there. If transmitters are not synthesized, then how the process can be initiated? So first of all, synthesis of transmitters will be there. Then after the synthesis, they should be stored. So when they are stored, a release of transmitters by nerve action potential. If there is no nerve action potential, there will be no release of the transmitters from there, from where they are stored. So after they are released, interaction of released transmitters with the receptors of the effector cell, and then the rapid removal of the transmitter, which is further responsible for the recovery of the effector cell into previous state. The next we have is cholinergic drugs. Drugs that stimulate the parasympathetic nervous systems are called cholinergics. So it is also called cholinergic agonist or parasympathomimetics. So these drugs mimic the effect of the acetylcholine. So as we know, what is acetylcholine? So it is a neurotransmitter which is responsible for the transmission of nerve impulse to the effector cells in the parasympathetic nervous system. So next we have is acetylcholine. So it is a major neurotransmitter in the parasympathetic system, and it is synthesized in the cholinergic nerve endings by the following pathway. When the Addition of choline into the or with the acetyl coenzyme A, it forms the acetylcholine by conjugation. So then there is next question which may come into the exam, or which, so from where acetyl coenzyme A is secreted. Acetyl coenzyme A is secreted from the nerve body. The next we have is storage of acetylcholine. The acetylcholine is stored in the vesicles along with calcium, ATP, proteins, and phospholipids. So, if we look at the release of the acetylcholine, so when the parasympathetic system is stimulated due to any reason, that develops action potential and that travels down to the nerve terminals. So, if the action potential is strong enough, then it causes opening of the calcium channel and calcium enters into the nerve terminal and fusion occurs. So, it causes the release of acetylcholine. Then next we have is cholinergic drugs. So drugs which mimic the action of cholinergic receptors called cholinergic drugs, and it is also called cholinomimetic drug. Then we have is classification of cholinergic drugs. So they are classified according to the mode of action. Cholinergic drugs are divided into directly acting and indirectly acting. So directly acting drugs are alkaloids and esters. So in case of alkaloids we have muscarine, nicotine, pilocarpine, and in case of esters we have acetylcholine, methacholine, and carbachol. And in case of indirectly acting, we have reversible and irreversible. In case of reversible, we have physostigmine, neostigmine, and pyridostigmine. And in case of irreversible, we have organophosphates, parathione, and diflos. So if we talk about the acetylcholine receptors, first one is nicotinic and muscarinic. Nicotinic receptors are of neuronal type and muscle type, and muscarinic receptors are of M1 neural, second M2 cardiac, and M3 glandular. Then next there is pharmacological action of cholinergic drugs. So first of all their action is muscarinic action. So effect on eye. So contraction of circular muscles of iris which cause miosis, and effect on heart. They act on the M2 receptors, so which causes decrease force of contraction, decrease AV conduction, decrease cardiac output, and decrease heart rate. And effect on blood vessels and vasodilation through release of EDRF, endothelium drift releasing factor. And effect on respiratory system is bronchoconstriction. Next is effect on GIT. It acts on the smooth muscles of GIT and it increases the contraction, thus increases the peristalsis. Next we have is effect on urinary system. So relaxation of sphincter of urinary bladder and causes contraction of visceral smooth muscles. So effect on glands, it increase glandular secretion and cause sweating, salivation, lacrimation, and gastric secretion. And next we have is nicotinic action. So in case of nicotinic action, its effect on skeletal neuromuscular junction. So when acetylcholine act on the nicotinic receptor of skeletal muscle causes contraction. And next is effect on adrenal medulla. It causes stimulation of chromaffin cells, secretion of adrenaline in 80% and noradrenaline in 20%, which further causes vasoconstriction and which results in increase in BP. What are the therapeutic uses? Glaucoma, myasthenia gravis, and urinary tension. What are its side effects? Its side effects are sweating, salivation, cramps, and micturition. And contradiction or indication of acetylcholine esters are the peptic ulcers and asthma. Then there is a term anticholinesterase. So these are the agents which inhibit the cholinesterase and protect the acetylcholine from hydrolysis. So also we have pharmacological action of anticholinesterase. Their effect of CNS, low dose and high dose. Low dose cause alertness and high dose cause convulsions. Then next we have effect on eye. It causes contraction of ciliary body and facilitate the outflow of aqueous humor. And next we have is effect on GIT. So contract the smooth muscle of GIT and increase the peristalsis. And next we have is fourth one is effect on skeletal muscles. So it increases the strength of muscle contraction. So next we have is organophosphorus compounds. So organophosphate is a commonly used in the agricultural, industrial and home setting, and these compounds are used as insecticides and chemical welfare. So they are highly lipid soluble and can easily penetrate any organic barrier. So if we look at the mechanism of action, so as we know, the major neurotransmitter in cholinergic system is acetylcholine. So the enzyme called cholinesterase, it degrades or destroys the acetylcholine. So that's why organophosphorus compounds block this enzyme, thus preventing the breakdown of acetylcholine. And so next is organophosphorus poisoning. So the organophosphorus compounds are easily accessible and are often used to commit suicides. So signs and symptoms of the organophosphorus compound poisoning are severe bronchoconstriction with excessive bronchial secretion and excessive sweating, decreased heart rate, severe headache, and excessive salivation from mouth. Next is treatment of organophosphorus poisoning are the it is treated using the drugs that block the action of acetylcholine, that is atropine, and drugs that regenerate the cholinesterase enzyme, pralidoxime and opidoxime. Next is anticholinergic drug. It is also called parasympatholytic or muscarinic receptor antagonist. So a drug which bind with the cholinergic receptor and block the action of acetylcholine is called anticholinergic drugs. So its prototype is atropine and it is an alkaloid obtained from the plant Atropa belladonna. So next is classification of anticholinergic drugs. Its classification, first classification is natural sources, atropine, scopolamine, and semi-synthetic sources are homotropine and ipratropium bromide. Next is synthetic sources, tropicamine and cyclopentolate. And pharmacological action of anticholinergic drugs are effect on the eye, which causes mydriasis, and then is effect on the glands, which decreases glandular secretion, and effect on smooth muscles and relaxation in smooth muscle. Next is lungs, which causes bronchodilation, and in case of intestine, it causes decrease in motility, and which further causes the constipation. And in case of urinary bladder, it causes urinary tension. And when they act on the heart, they increase the conduction and contraction, causes the tachycardia. The next is body temperature. It increases body temperature through inhibition of sweating. The next is effect on CNS. So it decreases vestibular excitation, anti-motion sickness property. Then third one is therapeutic uses. So it is a pre-anesthetic medication, peptic ulcer, pulmonary embolism, bronchial asthma, Parkinsonism, motion sickness, and side effects are the dryness of mouth, skin and eyes, photophobia, blurring of near vision, and difficulty in micturition. So its contraindication are prostatic hypertrophy, which causes urinary tension and acute congestive glaucoma. Next is drugs acting on autonomic ganglia. They are either stimulate ganglia and block ganglia. Uh, Drugs that stimulate the ganglia is called ganglionic stimulant, and drugs that block the ganglia they are called ganglionic blocker. Then in case of ganglionic stimulant, classification of ganglionic stimulants are the muscarinic agonist and nicotinic agonist. So in case of muscarinic agonist, acetylcholine and pilocarpine, and nicotinic agonist are nicotine and lobeline. And if we look at the pharmacology action of ganglionic stimulants, effect on heart, it causes bradycardia. Effect on iris, it causes myosis. Effect on intestine, it increases motility and diarrhea. And if we look at its effect on glands, it increases glandular secretion. So in case of ganglionic blocker, we have mecamilin and trimethophan. And if we look at the pharmacology action of ganglionic blocker, it causes effect on heart, it causes tachycardia, and its effect on iris, mydriasis. And if we look at the effects of on intestine, it decreases motility, which further cause constipation. And if we look at its effect on glands, it decreases glandular secretion. And if we look at the effects on male sexual functions, it inhibits erection and ejaculation, which further causes the impotence. So student, that is all for the day. In the next lecture, we will discuss about the adrenergic receptors. So thank you.